Well, good afternoon. We have some information I'm going to update you on, and I think we need to start to have a conversation as a state and a city to what is happening on COVID, because these are the worst infection rates we have seen, I believe, really, since almost a year ago. What I have up here is what comes out every day in the New York Times. It's the New York Times hot map. I've showed it from time to time over the last year. Yellow and white areas are the places where COVID is lowest. The darker red it gets, those are the areas that have the highest infection rate. And as you can see, the state of Michigan stands out far and away the #1 place in America as a COVID hotspot. It's going to spread to the other states. But right now, the state of Michigan is far and away the most dangerous place to be if you're concerned about getting COVID. And so I want to talk about where we've been and as a city where we are now, because the news is not good. So last October, I stood here and talked to you about what a great job the people of the city of Detroit had done with masking and distancing. We were national leaders. And I showed you this last October. The positive rate, the percentage of people who test positive for COVID in the state, were at 4.9%, and in the city of Detroit, we were down at 2%. And I pointed out then that Oakland and Wayne County were double Detroit's rate, and Macomb County was triple. I got a lot of angry phone calls from Oakland and Macomb County, and I didn't back down because I was telling the truth. The fact of the matter was that people in the surrounding communities were not making the commitment to masking and distancing, and it mattered. Unfortunately, today, I'm also going to tell the truth, and it's going exactly the opposite direction. Everything that we were so proud of for the last 9 months, being a leader, we've had attention nationally. National Geographic wrote a huge story across the country. They've talked about the fact that the people of Detroit dropped the COVID infection rate like nobody else in the country. We were the national story. We are not a national model right now. And I will show you why, and I'm hoping that we will pull together as we did a year ago and beat this thing as a community. So this is the state of Michigan. And hot spots, as you can see where they start, they aren't where you think they'd be. They tend to be in poor areas, not just poor black areas, they tend to be in poor white areas as well. What we are seeing in this country is now an income divide, where the wealthier people are getting vaccinated at very high rates and poorer people are not. And so you had rural areas in the Upper Peninsula. And right up here at the tip of the thumb was one of the hot spots. And here is the hot spot today. And look at the way it is spreading down through the thumb, into Macomb County, and into the city of Detroit. This is the most intense COVID infection rate. And the problem is in Detroit, we are not sufficiently vaccinated to protect ourselves against what is coming and what we are experiencing. And so these are numbers that aren't good for us. Statewide, 35% of the people, adults in this state, have been vaccinated. In Oakland County, it's been 38%. Western Wayne, it's been 38%. Macomb, which is trailing behind as it has been, at 31%. But this is what's really disappointing. In the city of Detroit, only 21% of adults, just over 100,000 people, have been vaccinated. And because we have lower protection, as that virus spreads down through the thumb and into the city of Detroit, more and more of our citizens are going to be hospitalized. This is just the last 7 days of what's happened. Or actually, it's the last month. It says 7 days, but it's the last month. We've gone from 2% affection to 16%. In the last 2 weeks, the number of Detroiters in hospitals has tripled. We've now got more than 260 Detroiters hospitalized for COVID, and they are overwhelmingly people in their 30s and 40s and 50s because they haven't been eligible for vaccination. If this triples again in another 2 or 3 weeks, we are talking about the kinds of levels we saw last March and April when people were on gurneys in hallways. This is real, and it is hitting our city now in a way that we are not properly preparing for. And so our positivity rate, suburbs used to be double or triple Detroit. Now, State of Michigan's 15, Oakland County's at 14.8, we're at 16.3. We are higher than Oakland County, almost identical to Wayne County, and for a long time, Macomb County was running triple Detroit's infection rate. Now it's only slightly above it, and in the direction we're going, we could, within 2 or 3 weeks, have the highest infection rate. We could be heading toward a situation where it's the Detroit businesses that are being shut down because we didn't take the steps that were available to us. This pattern is emerging in different ways across the country, but what they're all seeing is this: the wealthier the community, the higher the vaccination rate. That's just the case. We saw it early on when wealthy people managed to get into the hospitals in the poorest neighborhoods because they accessed the electronic record system and got appointments, which is why we set up everything we did at TCF. But here in the city of Detroit, there does not have to be an income gap because nobody has more access to vaccines quicker than residents of this city. I want to show you how much of a difference it makes what your choices are. This is Washtenaw County, Ann Arbor, Ypsilanti. Okay? And if you look at the map, it's the light orange. On all 4 sides, Washtenaw County has neighboring counties with higher infection rates. Is that coincidence? It's not, because the Washtenaw County vaccination rate at 41% is the highest in the state. Detroit's is 21%. And you want to talk about infection rate? The infection rate in Washtenaw County is now 4%. We are at 16%. People in Washtenaw County are getting vaccinated. And as COVID is spreading through the state, they are protecting themselves, their families, their citizens. We have the tool to beat this thing. And we need to do what our wealthier neighbors are doing, which is take advantage of the vaccine. And so we've done a number of things, including the $2 rides. But we are about to do now is the most significant outreach we've done to the neighborhoods. And so you know what the steps are, but Dr. Iris Taylor, who's our head of nursing, said, I want to set up centers in every single neighborhood. And so I'm really glad that we have our partners here today from the Detroit Public Schools and the Islamic Center of Detroit. They're going to help us set up in every neighborhood. This is going to be next week. So if accessibility is an issue, and this is what we're going to keep doing, we're going to keep moving more and more out closer to people. But next week, the Johnson & Johnson one-shot vaccine, for those who want that option, will be 8 to 5. On Monday, we're going out to Henry Ford and Western high schools. We'll be there all day. Tuesday, we'll be at Randolph over at McNichols and Hubble. On Wednesday, we'll be at Brenda Scott on Hoover on the east side and Cass Tech. On Thursday, we'll be at the Bright Hop Center on the west side and the Islamic Center of Detroit over near the border. And on Friday, we'll be over on Cadieux at East English Village. And so whichever one of these neighborhoods you are in, if you want to be able to go to a school or a center near your house, next week, Monday through Friday, you can call and get your appointment now, and you can do this. We are going to keep moving this out farther and farther. All we can do is make the opportunity available to you. If you look at the infection rate spreading south into the city of Detroit and say, you know what, I don't need to get vaccinated, I don't know how to be able to have that conversation. It's very clear what's happening here. If you talk to anybody that you know who works in a hospital, they'll tell you what they are seeing. So, here's what you have. You've actually got 5 different ways to get your flu shots. 3 ways to get a Pfizer 2-shot vaccine, 2 ways to get the Johnson & Johnson 1-shot vaccine. And the beauty is in the city of Detroit, you don't have to navigate a bunch of websites, sit on hold, try to catch your local CVS, try to figure out how to get to your hospital. You just dial one number, and somebody is going to answer the phone. They will give you your 5 choices, and you can book whichever one of the 5 is best for you. So if you want the Pfizer 2-shot vaccine, TCF Center, drive-through, we're up to 8,000 appointments a day. We've expanded from 5,000 to 8,000. We can take everybody. If you call today, you'll get an appointment in the next 2 days, and you can be vaccinated. And I need people to think about talking to their friends and their neighbors. If they're homebound, if they're a little bit scared, come pick them up. You can do our Saturdays, which we've been doing at the churches. And this Saturday from 9 to 1, we'll be at Fellowship Chapel over on West Outer Drive, and we'll be over at 2nd Ebenezer off of McNichols and 75 on the east side. And so if you want the Pfizer 2-shot vaccine, you want to do it on a Saturday, you want to do it somewhere closer to your house, we will be at both these churches on Saturday. And our city employees, who in May will be back in the office, we have our special family day this Saturday at TCF. Everybody in your family can come in and get their Pfizer shot at TCF. So if you want a 2-shot vaccine, these are the choices available to you, downtown, neighborhood churches, or with your family. If you want the Johnson & Johnson 1-shot vaccine, you can go Monday through Friday at the Northwest Activity Center. We're open there 5 days a week at 9 to 1. Or you could come next week, where we are going to be at Western High School and the Islamic Center and all those other places that I showed you in your neighborhood. You have 5 choices with 1 telephone number. But this, over the next few weeks, is going to decide what our summer is like. There is no reason this city can't be reopened and back to normal by the end of summer. But if our vaccine rate is running far less than the surrounding communities, we're not going to make it. Our future is in our hands. And so I am just so pleased at what Denise Fair and the Detroit Health Department have done in now partnering up with the schools and the Islamic centers to push these vaccines closer and closer to give you every different option you could possibly want. And I'm hoping we respond the way we did a year ago and step up and become leaders. And with that, I will turn it over to our health director, Denise Fair.
Thank you, Mr. Mayor. So the data that the mayor just presented is really alarming. It's actually really disappointing because we have come so far, and I'd hate for us to backpedal. We are now at 36,160 confirmed cases, which, to put this in perspective, this is up from 1,607 cases just since Tigers opening day last week. And we're only at a 21% vaccination rate. The only way that we're going to beat COVID-19 is to significantly expand our vaccination efforts. You know, the mayor has said this multiple times before, but I believe this is the only city in the entire country where it is so easy to get a vaccine. You just call one number and you have multiple options. So starting next week, as the mayor indicated, we are creating more access for Detroiters across the city, bringing 8 new locations online next week in partnership with DPSCD and the Islamic Center of Detroit. We're also supporting this with a media campaign that is running on cable TV, radio, and billboards. And the city will be out knocking on doors in these neighborhoods to get the word out. We just want to make sure that everyone who wants to get the vaccine can get it, because it remains the best tool that we have to fighting COVID-19. Now, I do want to speak to those who are under 40 years old, because the data is showing us now that 40% of all of our new cases are in between the ages of 20 to 39. We did not see this last year. At the time, we didn't have access to the vaccine, and as now vaccines are arriving and more seniors were able to get vaccinated, we saw a change for the better within the seniors. And we want the same for the younger population. And so now anyone ages 16 or older can have the opportunity to protect themselves, and I urge everyone to take advantage and get vaccinated. As I've said before, the vaccine is safe, it is effective, it is helpful in preventing hospitalizations and also death. Now, don't just take our word for it, but ask your family. Ask your family and friends who are among the many Detroiters who have already received their vaccine. I was speaking to a couple of young people the other day at Brass Rail when I was out with my team enforcing, and I was alarmed by what I heard. There were a few people who just said they don't want the vaccine, they don't need it, they were healthy and had no interest. And for me, it is the indifference that is unsettling. And so I am hoping that everyone takes advantage of the opportunity to go ahead and get vaccinated, and please do not miss the urgency. And so with that, I'm going to turn it over now to Dr. Iris Taylor, who's the Director of Nursing at the Detroit Health Department, who is leading the Neighborhood Vaccine Week and is doing an amazing job. And so with that, I'll turn it over to you.
Thank you, Denise. One of the things that's critically important is that we provide equitable access to everyone in the citizens of Detroit. And to do so, we want to be in your neighborhood. In your neighborhood where you trust institutions that you're familiar with and a convenient way to get in and get out with excellent customer service. We realize that the only way that we can do this is with partnerships. And so we've extended ourselves in the community and the churches, and we're extending ourselves within the School of DPSCD and with the Islamic Center. And so today we have with us Ms. Mary Weather, as well as Mr. Nahab from the Islamic Center as part of our partnerships. We realize that the only way that we're going to beat COVID-19 is that we partner, that we educate, that we support individuals' decisions, but we also encourage them that their decisions not only affect themselves, but they affect others. And so we need to protect each other while we're making our decisions regarding ourselves individually. And with that, I'd like to allow Ms. Mary Weather and Mr. Nahab an opportunity to talk about their partnerships with us.
Well, thank you, Dr. Taylor, Denise Fair, Mayor Duggan. Definitely on behalf of Detroit Public Schools Community District, we are thankful for this partnership. We think it is a critical step in the right direction to bring vaccinations closer to the neighborhoods, to schools that people know in their neighborhood. And now that the vaccine is available for 16 and up, also really making it available to students who are 16 and their families, their mothers, fathers, grandparents, et cetera. And so we are just thankful for the partnership. We are in this together. Detroit can do this. We've done this before. We've done hard things before, but this really, as the mayor laid out, is critically important right now for people to make a move in the right direction to fight this virus. It is everyone's responsibility to continue to wear the mask, social distance, et cetera, but the vaccine access is critical. So thank you very much. We are excited to continue in partnership with you, and I really just encourage everyone to look at the information, share the information, and just know that your DPSCD schools that are open will be ready to welcome you should you choose to get the vaccine. It's a one-shot at the school location, so just one and done at the school locations.
Thank you. Bismillahirrahmanirrahim. Assalamu alaikum. Peace be upon you. Thank you for inviting me today. My name is Sufyan Nabhan from the Islamic Center of Detroit. The Islamic Center of Detroit, ICD, is one of the largest Islamic centers in the state of Michigan. We are a faith-based community service center where we serve Detroiters and the surrounding community and different services. We are pleased today to be part of the vaccination center in the city of Detroit, to be able to ease the burden of looking for appointments and to increase the number of vaccinated people in the city of Detroit. We are very happy to be part of saving lives and making Detroit safer. We encourage our community to take advantage of the new vaccine locations in the city of Detroit and to go and get vaccinated. For our Muslim community, Ramadan Mubarak, happy Ramadan. Ramadan will start on April 13, Tuesday, for 30 days. Our scholars determined that getting vaccination while you are fasting is okay, will not break your fast. So please get vaccinated and let us celebrate Ramadan in safety and in enjoyable Ramadan. Please get vaccinated and keep yourself and your family safe. Thank you.
With that, we'll take any questions.
Okay, Mayor, we've got a question, similar question from Sarah Rahal from the Detroit News and Eli Newman from WDET. wanting to know if the city's infection rate continues to rise, if the state doesn't impose any further restrictions on gathering, would the city do it on its own?
You know, we're talking to the governor on a daily basis right now, and the question, and I know the governor is very much focused on this, is I don't know that we've got evidence that the spread is occurring at stores or sit-down restaurants. I think the spread is occurring at family and social gatherings. And so the real question the governor's got to answer is, are restrictions going to have a significant effect on this? Nobody has to explain to me about COVID fatigue. People are tired of wearing their masks, they're tired of being separate, but you just look at that map and what's happening and say, there's an easy solution. Go get your vaccination. You can hug your kids again, your mother again, you can gather with friends again. The CDC has said if you've been vaccinated, families can be together. And I don't even know how to express this. Once you've had that second vaccine, the stress that is off of you, it not worrying about either catching it yourself or spreading it to people you care about, we have the ability here to deal with it. But I'm more focused on speeding up vaccinations and getting them out to more locations, and the governor will end up making a decision on restrictions.
Okay, and then something you said just speaks to the next question, and that is, beyond the week of the 12th to the 16th, do you foresee doing similar pushes where you're in multiple locations at the same time?
We are going to do nothing but build this out, and it'll be built out through pharmacies, it'll be built out through doctors' offices, it'll be built out to a lot more community centers, and so next week is a major step in the right direction, getting vaccines into every area of the city. The week after that, we'll expand it even further. But yes, this is the odd thing right now, we have enough vaccines. Between the Johnson & Johnson and the Moderna and the Pfizer, the president just sent an extra 60,000 vaccines to the state of Michigan because we are the national hotspot. We've got the vaccines. There is no reason right now. We've increased the capacity at TCF. We've increased the capacity at the Northwest Activity Center. It's just a question of people of the city saying, I'm going to watch out for my neighbor, I'm going to watch out for my family member, I'm going to get vaccinated.
Okay. One last question on a different topic. Mayor, there's a package of bills, I believe Republicans sponsored up in Lansing, that would affect elections and voting access, and want to see if you had any thoughts on that.
Well, this proposed legislation is deeply troubling, and it needs to get stopped right now. There is no other way to describe it. It's voter suppression. You look at what these bills are doing, and you watch this last cycle. This is what I really don't understand. My father was a lifelong Republican. He was a militant Republican. He thought the goal of the Republican Party was to get a majority vote. There's a segment now that couldn't care less about being a majority. They want to be the ruling party. And the objective is, how are we assure ourselves we're the ruling party even when most people don't support us? And we watched last year, and they had a 5-step process that every one of us watched. First, they tried to put restrictions on the ability of people to vote. Then they went out and discredited the election process, claiming there was fraud so that they could challenge it when they lost because they couldn't get 51%. Then they filed all kinds of frivolous court cases, hoping to get a judge they appointed to rule for them. When that didn't work, they went and appealed to state legislatures to overturn votes, as they did when they called the legislative leaders in Michigan to Washington, D.C. And when that didn't work, they went to Congress, even storming the Capitol. That was just a few weeks ago. They have just started the 5-step process all over again, like nobody's going to notice, with a package of bills in Michigan to restrict people's right to vote. This has been described as Jim Crow laws, and it's hard to describe it as anything else. This is a desire by a group of people to maintain control by denying other people their rights. And you look at what they're doing, the deviousness of it. Under these laws, if they pass them, if you want to vote absentee, you can't just print an absentee ballot application off of your computer and send it in. They're banning that. You have to actually mail in to get the application. And when your ballot comes, The clerk is no longer allowed, under this law, to put stamps on the ballot. So when you fill it out, you can stick it in the mail. Nope, they won't, you can't put the stamps on the ballot. So if you put stuff off too long, who's got the ability to get in a car and go down to the post office and buy some stamps? It's disproportionately people who are more mobile. Of course, this last time, we were able to put them in drop boxes. So they covered that by they put significant restrictions in these ballot drop boxes, so you don't have the convenience to do that. What they are doing is systematically layering obstacles. So people of lower income and people of color have a much harder time voting. There's no other way to describe it. And you're seeing now the business community in Atlanta and in Texas and some other places speak up. And I hope the businesses in Michigan don't make the mistake they did in Georgia and wait till the law is passed and then realize that you have bought into a system that says we are going to be a ruling power regardless of whether we have majority support. I'm hoping that the corporate leadership in this state steps up in a very big way and makes their feelings known. I'm all for good competition between Democrats and Republicans, and whichever of us gets a majority vote should be in charge. We can't have a system where you try to be in charge by denying people the right to vote. That's what these bills do. And interestingly, the Michigan Chamber of Commerce has not had a history of voter suppression, and I think this will be a test of moral leadership there too. I'm hoping the corporate community in this state steps in a big way right now, and these folks in Lansing back off, because this will be a really bad thing for the state of Michigan if this gets pursued.
Okay, thank you. There is one more question that just came in from Sandra McNeil at WWJ. She wanted to know of the appointments that we're scheduling, primarily, I think, at TCF, what percentage of the people are showing up for their appointments?
I don't know, 95% plus?
Okay, all right, that is it.
Thank you.
Thank you.